Welcome to an episode of Raising Youth Voices podcast series. We are now in our third season. My name is Eddie Brown. I'm the director of the Greater Hartford Youth Leadership Academy at Hartford Communities That Care. And our youth initiative is Raising Youth Voices. I want to first special thanks to the Alliance for Strong Families and Communities for this opportunity. Working with you, our role is to bring youth perspectives to the 4-part Excelerator series on reimagining child welfare and serving as a bridge between these sessions. Our Child and Injury and Fatalities Prevention Work Group this past spring and summer interviewed state agency and hospital officials, building on the research we've done back in 2017 on preventing gun violence. Our youth leaders here that I'm honored to speak with today, Nezra Adams, Jaron Langford, and our college and youth ambassador, Deja Borns. Each of these youth have been learning how to use research and to translate their life experiences into problem statements with root causes, local conditions, strategies, and interventions to address the problem. In other words, we're becoming evidence-based advocates. In our past summits back in 2018 and 2019, our youth have been presenters and discussion leaders at legislative and deliberative forums and national public radio interviews, providing urban perspectives on the March for Our Lives, as well as in testimony delivered at the State General Assembly. These young people have taken on some of society's hardest issues, but none is more important than reimagining the child welfare system. So today we're going to start by reviewing this past Thursday's opening session on COVID-19 responses and recovery activities, and then we'll close by previewing the topic coming up next Thursday, November 5th, which is building justice and equity in child welfare agencies. So without further ado, let's get into it. And before we start, I actually just want to check in with each of the youth. Welcome, guys. How you guys doing? Good. Let's start off with check-ins. How's everything going? This new normal and return to learn with school and everything that you guys got going on. We'll go around real quick and just share a quick check-in.
My week was fine. I did the usual work, then sleep at like 9 o'clock and then work again. But I actually finished the training last week and I did the test this week, and I actually got my certification to actually like help people with trauma and stuff like that, especially recognizing triggers and teaching people self-care.
Awesome. Congratulations.
Well, my week was pretty uneventful with school and stuff. It's just I'm busy like 24/7, so same thing. I got online Monday, Tuesday, Wednesday, and online schooling. It's not for me. It's like I'll get through it, but it's not preferred. And then I go in on Thursday and Friday. But this week was PSAT week, so my whole schedule was messed up. It was weird. So that was my week.
Very intense week, man, but keep pushing through. You got this.
My week has been stressful. I'm in a lot of programs, different organizations, different things, and I have to get a lot of work done while also kind of raising 2 little siblings. So it's kind of been stressful, but just pulling it through, making it work.
That's the best we got to do. Just make it work. But again, thank you guys for joining. And we're just going to raise some good conversations, again, for this past series on COVID-19 response and recovery in the Excelerator Alliance Conference. My first question I want to ask you guys is from New York Life, Maria Collins. She was one of the presenters, as well as Tuesday's Children, Sally Lynch, Centers for the Disease Control, Sarah Bacon. Overall, with their presentations, how can academic diagrams and definitions of tragedy be translated for building trust in our community? And any one of you can start.
I feel like it can build trust in the community is by teaching people that, teaching people about these things that they probably didn't know about. So that's what we kind of lack as a community, is education. And so when we show those diagrams and we teach people there's different ways of learning things, then that's where we are able to build the community up. Because for me, I know that I need to listen and see. So if I don't listen and see it, I will not retain it. But a lot of people are just, I need to see it. So like seeing diagrams and all that other stuff is like good for them. So like teaching people different ways of learning and different definitions is, yeah, I feel like that's builds trust because it shows you care.
I think that by definition, a tragedy within the community should bring the community together, because they're all experiencing the same loss, suffering, and hurt, and thus they all have a common pain that they can lean on each other to support themselves with. And so I think that by definition, tragedy should pull these people together and create a common trust within the community.
Yeah, to go back off what they both said. Yeah, just being able to know that someone else in my community also understands what I've been through. They've been through what I've been through, and they're actually hearing me, listening to me, and they get what I'm saying. That can build a lot of trust, and being aware of the actual definition of trauma and stuff like that.
Excellent. That's beautiful. You know, trust in the community is important. A lot of communities are divided. A lot of communities are separated. So I think, you know, building that trust to know, you know, and be aware of these issues are great. Moving on with ACEs, adverse childhood experiences. They're said to be preventable. If so, what do you think stands between our systems and effective prevention, especially under these conditions in COVID-19?
I think especially now, it's a lot harder to get into homes and see the problems that are going on within the homes because of COVID. And so that's a huge problem, because you can't physically see the surrounding of the child, and you can't physically see the child's manner, how he's acting, to see if he's going through any abuse. And even before, when there were home checks, abuse like mental abuse is so unfortunately easy to hide, especially when you don't know what you're looking for. And so I think the only thing that could really stop that barrier is to improve home checks and improve the way we analyze the child and how the child's acting and what's going on around the child.
I feel like that it is, like Jared said, it is the DCF system, the CPS. It's pretty difficult to check homes now due to COVID. Like, you know, people are scared for their families and going in and out of people's homes, and you don't know what people have. But putting people in these homes, you're responsible for putting people in these homes, and kids in these homes, and you are doing things over the phone, which for me, my little cousin actually stays with us temporarily, and we were doing a walkthrough. So basically, they were checking the house to see if it was A-okay, and they were doing it over the phone. So it was like, they were just like, okay, show me this, show me that. So like over the phone, you could show them anything. So, and the kid could tell you anything because you are being prepared for it. So like, okay, so they give you a few weeks in advance or something like that. And they could tell the kid to like say this, say that, and make it look like the home is fine and dandy. But a lot of these things that CPS does, I know that it is for good intentions, but they also need to look within their system to see exactly what needs to be fixed. But I got a quote from an article, totally forgot what it was, my bad. But residents of Black neighborhoods live in fear of state agents entering their homes, interrogating them, and taking their children as much as they fear police harassing them in the streets. So I feel like that's even bigger because we hear a lot about police brutality, but what about, kids being taken from homes? And then on top of that, a lot of Black communities, they live in not so great areas. So like abandoned houses and, trying to make it over the poverty line. So it's just like, it's pretty hard. And plus there's a lot of systems in place to keep people of color down. So how are we supposed to make sure our house is straight, and we have to provide transportation for ourselves and our kids, and then on top of that, try to find daycare, which is like $1,000 in total, but $750 a month, while trying to feed their kids. So it's just like, it's a lot of systems that aren't helping people that are impoverished. So
yeah, that's very important, because again, you're mentioning all this stuff that's going on now as this spike leaded higher, but all of this stuff before COVID, was going on. So just imagine during this pandemic, a lot of things got worse. So thanks for sharing. That was very insightful. My next question, I want to direct this towards Nezra. Nezra, so considering, root causes, local conditions, a lot of things you guys have been studying, as well as inequities reflected by the ACEs diagram, where should our community start to address ACEs, the adverse childhood experiences?
Like Deja was saying, the CPS has a lot of good things going on, and they actually want to help, but we also have a lot of problems with it. So I think that we should start by dismantling it, so we can slowly start to break it down and figure out what the actual problem is, because we're not going to be able to find a solution if we're not really aware about the full problem. So even if we start by like trying to stop taking kids out of their homes, trying to stop, instead of telling parents what they should do, they should ask people, how can we help? Ask these parents, what can we do to help you keep your child, and instead of trying to take their kid away from them. Because kids being pulled out of homes, they're seeing different things, they're going through different traumas. And it was actually a pediatrician, sorry, I forgot her name. There was a pediatrician who said that going through different traumas and seeing different things can actually change our physiology, and it's really messing with the emotional and mental state of these kids. And people with the higher ACE scores are becoming physically messed up. If it's not messing them up mentally, it's physically messing them up. So they're at a triple risk of cancer, lung cancer, and heart disease and stuff like that. So I think that we should really start by dismantling the system, figuring out where our problem is.
So to add on to hers, I actually got another quote from an article. I'm sorry, I need to put these in here. But it says that it's true that there are racial disparities in child welfare, and not just in New York, but across the country. And the Administration for Child Services is acknowledging and addressing them. Chafee stated in an email, and he recommended better training for mandated reporters so that their accounts are objective and result in help for children when they truly need it. So that statement in itself is true. Like I said before, we have a lot of disparities in child welfare, but also what Nezra said with the telling parents what to do instead of helping them. Because like when the kids get taken from households, they go into classes for their kids, and kids, teenagers and kids already, they do things just to pass the test. So like basically they could listen all they want to and just take a test, and then they get their kids back. But like, what are they doing physically to actually show that they're going to treat their child the way they need to be treated? And also there's another quote from another article about the CPS. It says 4 in 5 child neglect cases include prenatal drug use, and that there is a deep stigma around whether or not you are a good parent. Miles Cloud said, we need to need a concerted effort to decrease the isolation to support people resisting that narrative. And also, there was a story about this girl that was using. She told her doctors that she was using marijuana a lot during her pregnancy, and then as soon as the baby was born, they kind of ignored it before. So like when the baby was born, they took a urine sample and found a lot of cannabis, so they took the child away. So like she told you guys in advance, and then you ignored it because you were like, okay, whatever. And then when the kid is finally born, she can't even have that child at the end of the day. Like she was searching for help to, you know, stop doing it while she was pregnant. And then as soon as she, like, you know, gives birth, she has to live without a kid that she was so ready to take care of for those 9 months. So like Nezra said, we need to dismantle, but a lot of the articles said to abolish it, but like I feel like we need to dismantle it and see the different systems and how they are working together to help these kids find better homes.
Yeah, definitely. That's important. You know, the supports need to be there because, you know, that's a cry out for help. And if nobody's there to assist, that's a problem. You know, so our community, you know, should start there with dismantling, abolishing, but more importantly, raising awareness as you guys are doing your research and finding out and being the voice to this awareness in addition to the Excelerator. And I think it's important, you know, if they're crying out for help, you know, there need to be some supports in place to assist. So getting into my next question, Deidre, just to start this out, how do you recommend helping the children whose trauma was not treated and persisted into adulthood?
I feel like therapy is a good resource. For me, it was a good resource, but I didn't get therapy until I was like, well, I was getting therapy, but it didn't really help. But it was like, because I didn't know how to talk about different things because I held it in for so long. So it was just like when I finally started going consistently to therapy, doing that one-on-one, I felt a lot better. But like going into you're 18 and up, you're considered an adult, quote unquote. So I think that seeing a therapist is a good resource, but I know a lot of people don't believe in that, so-called. It shows that you have something wrong with you, which a lot of people do because stress is a common thing in a lot of humans. So for me and a lot of other people, especially due to COVID, a lot of stress has been increased because they're trying to find out like what they were going to do with their kid, and then working from home and all that other stuff. So in a tracking poll conducted mid-July, 53% of adults in the United States reported that their mental health has been negatively impacted due to worry and stress over the coronavirus. And many adults are also reporting specific negative impacts on their mental health and well-being, such as difficulty sleeping, which was 30%, or eating, which was 32%, and increased in alcohol consumption or substance abuse, which was 12%, and worsening chronic conditions, which was also 12% due to worry and stress. And then David Sanders, I hope I said his name right, said that we should look at brain science and not to be reactive. So a lot of people, even before that, parents want to show their kid that they're strong, and then they just keep everything buried down, like burrowed down. So like now that it's like even more stressful because of COVID and like everything closing down and stuff like that, even though we're getting slowly back into the new normal, it's kind of hard finding different things, and especially when you have to find stuff for your kid, especially when you have a kid, it's even more hard because you got to find out ways to work around your work schedule to also fit their needs. So a lot of things that are in the system and society, they're more reactive instead of taking that time out to actually figure out why it's happening and like how can we help that person, because a lot of these things like sexual abuse, physical abuse, and neglect and malnutrition is a lot of things that parents have been holding on to. And then on top of that, when Nezra said earlier, when she was like, it's a lot of stress, especially taking care of my younger siblings, raising my younger siblings. A lot of parents do that, especially people of color. They'd like to push that narrative to be an adult. So it's a lot harder for a lot of kids to enjoy childhood because you have to watch your siblings and also make sure that they're okay while the parents going to work. So feeding, doing homework, doing chores, it's a lot to do as you're younger. So your brain is already in that adult mindset, which is a lot harder for your brain to process because you're supposed to be a kid and you're supposed to be going outside and hanging out with your friends, but instead you're cooped up in the house doing adult things. And then so it's a lot of trauma and stuff that you have to hold on to, especially when you're a child and you're going into adulthood.
And wow, when Deja was talking about the statistics, those are scary numbers, but at the same time, I think it's good that people can admit that they're going through these mental changes, because acceptance is always the first step to healing, especially when it comes to something mental. And so I think that it's a great thing that people can actually admit to them being stressed out, or admit to them increasing their substance use or increasing their alcohol consumption. And so I think that these children whose trauma persisted into adulthood, I think the first thing that should always happen is that they can recognize that they are traumatized and that they do have something that needs to be worked out.
But then there's also the statistics. These are statistics that they took from people that were willing. So like, how many more people are using substances, overusing substances, and have difficulty sleeping? Like, these are such a short percentage, but how many people were not willing to say that they have mental problems? So like, and especially for like kids, these are adults, but like, what about the kids? Like, a lot of parents like to say that my kid, there's nothing wrong with my kid. There's, what's wrong with you? Like, why do you think there's something wrong with you? Like, a lot of people have been through a lot of stuff. And then there's that thing where a lot of parents want their kid to talk to them, but then at the same time want to shut down their feelings and don't really consider the emotions that are coming behind the conversation. So it's like, yeah, adults, they do matter, but what about the kids that aren't willing to talk? And what about the adults that aren't willing to say that I have a mental health problem and how can I fix it?
And that happens especially within the African American community, where there's this stigma where you have to be so tough and so resilient, but in reality we are facing so much that there's no reason that we should need to be this resilient when there's so much stress and there's so much other things going on that would constantly be putting us down.
Definitely. You guys raised some great points. You guys raised some amazing points, and it really discusses the role of the positive parenting and association between those neighborhood social disadvantages and the brain development. Deja mentioned brain science, which is going to be 2 sessions. We're already 2 sessions ahead. We'll actually specifically get into that topic during the Accelerator, but it's really that early start and overall just really being less reactive and more proactive to these issues. So thank you guys for sharing. This was amazing. My last question, I want to start with Jaren in regards to emergency actions. So for families without jobs, income, affordable housing, and food security, Jaren, what emergency actions would lessen immediate and long-term harms?
I think you could just create support systems. And this because if people who are struggling know that they have these support systems, it isn't going to be as difficult for them to get through whatever they're going through, because they know they have a shoulder to lean on, and they know they have something that they can depend on that will help them out, whether it be financially, emotionally, or financially, emotionally, or even like in terms of, or even mentally. And so I think that support systems, something to lean on for struggling families, is always the best option, because they won't have to turn to these other negative ways to alleviate stress if they know they have something that isn't damaging to them or their child, but it's also helping them or their child. But I think also, unfortunately, this will be something that's difficult for people to take in, because a lot of people, like Deidre said earlier, refuse help and refuse to believe that they're struggling despite what's going on around them. But if people knew that there was something to help them, and that there was something that they could lean on, and that there was something that they could depend on throughout whatever they're going through, I think that's a big, even just knowing that there's something there, I think that's a big factor.
Any last thoughts from Nezra or Deidre on this question?
So like Jaren was saying, like the support system, like I know like throughout the whole COVID thing, I really do give props to HCTC and the Hartford Care response team, because they've been giving food and stuff like that. And they even even the YDS, which is, what is it? So I don't know.
Young, educated, determined to succeed.
Yeah, I'm sorry, my brain just went.
It's all good.
But they've been giving backpacks to families who needed food, and resources to, help with trauma and stuff, because the violence and stuff has been skyrocketing lately. So like, the constant waking up in the morning, 3-4 o'clock, and also like going to house visits and doing all these different things. It's just like, I give them so many props, because it's pretty difficult to do, especially when you have your own life to attend to. So I feel like there needs to be more resources and more systems in place to help these struggling families, like affordable housing, getting jobs, especially if you were formerly incarcerated and they have mental health that have been through rehab and stuff like that. So like there's many different things set in place, because like I said before, there are a lot of disparities in the system, and especially with healthcare and actually finding out different scales for different races and people, because I say this a lot, and it's like the scale for a white person or a Caucasian person is different from people of color, because we are naturally bigger and stuff like that. So like we are getting sicker because we're following a person that doesn't understand the things that our body naturally goes through. So there's a lot of things that need to be done within the system to help people that are impoverished, and gentrification needs to like go a little bit, tiny bit, but yeah.
Definitely. Last thoughts, Nezra, and then we'll wrap up.
I also think that like based off what they said, we need to provide more resources for people. But I think that we need resources for parents, so that they're able to teach their kids the right way to go. This is this is where mommy messed up, or this is where daddy messed up, and this is why we might not have the best house, or why we're kind of impoverished and stuff like that. But this is the direction that you need to go. Don't follow the direction that mommy went to go with. but you need to follow this direction. And we just need more systems and more organizations to show youth how to get money and how to be able to survive on their own and stuff like that.
Amazing. Definitely. Thank you all for sharing once again. This has been an amazing conversation. So as we recognize that, we're just a small group in a medium-sized city, all of us share giant hope for our society that we can finally face and erase systemic racism and inequities at the root of the community violence. Again, please know, those that are watching, that you will have our attention throughout this entire series. We look forward to our next session, which is Building Justice and Equity in Child Welfare Agencies. Again, thank you to the Alliance for Strong Families and Communities. Thank you to the stellar youth that are here with me today, Youth and College Ambassador Deja Borns, Jaron Langford, and Nezra Adams. Again, you can stay connected, all social media platforms, Raising Youth Voices, as well as our website, www.hartfordctc.org. Thank you so much.